So what can you do to develop your critical thinking? Everything starts with the stem of the question. You need to be able to identify the 5 key factors of an NCLEX question. Number 1, who is your client? Number 2, what is your patient's problem or medical diagnosis? Number 3, do you have subjective or objective data? Number 4, any keywords? And number 5, is this a priority question or a nursing content question? Let's use the 5 factors of an NCLEX question to identify this scenario. The nurse is caring for a client with a right below the knee amputation. The nurse observed a large amount of bright red blood on the client's residual limb dressing. Which intervention should the nurse implement first? So who is your patient? A client. What is going on with your patient? A right below the knee amputation. The nurse observed, keyword, what did the nurse see? A large amount of bright red blood. These are keywords. Large amount is not the same as scant amount. Bright red is not the same as dark red. And the 5th factor, which intervention should the nurse implement first? This is a priority keyword. So what type of question this is? This is a prioritization question or an application and analysis style question. In order to develop your critical thinking, you have to understand what the question is saying. Sometimes you will see it very easy in questions like, which patient is a priority, or what is the nurse's first priority? It is very simple to identify that that is a priority question, but sometimes it's not as clear. Do you want to know a secret to having success on the NCLEX? Focus on the stem of the question. Everything you need to answer the question is there. Identify if the question is a prioritization question or not. But sometimes priority is not as clear. Which patient is a priority? What is the nurse's first priority? It is very simple to understand that this is a priority question, but sometimes the question does not even mention the word priority, and it's still a priority question, such as a patient arrives in the emergency room, a patient arrives by ambulance, a nurse is caring for a patient after returning to the floor. What is the most important intervention, or which patient should the nurse see or call first? All those are examples of priority questions, but students do not see it as clear.